welcome to a brand new edition of Good Life Mantra. I'm Nischita. There is bad news for you smokers out there, but some good news for cancer patients. Exercise may work as effectively as a wonder drug for cancer survivors by keeping the disease at bay.
Smokers who are inclined to take a few puffs soon after waking up may face an increased risk of developing lung, head and neck cancers than smokers who do it later. Compared with individuals who smoke more than 60 minutes after waking up, individuals who smoke 31 to 60 minutes after waking up were 1.5 times more likely to develop head and neck cancer. So smoking can lead to cancer. Everyone knows that. But there is some good news for cancer patients out there. Exercise could be the answer to one of the world's most feared diseases, cancer. This is the shocking revelation according to the British charity Macmillan Cancer Support. Such activity could also help cancer victims undergoing treatment. The study shows that advising the patients exercise brings out more favorable results than prescribing rest. More than 60 studies reviewed for the charity found that physical activity during treatment had positive effects on a victim's mood and well-being. Once treatment is through, exercise can lessen the side effects such as swelling, anxiety, depression, fatigue, impaired mobility and weight changes. For example, women with breast cancer who exercise moderately for 2.5 hours every week can prolong their life. This level of exercise also helps in remission of disease by more than 40% compared to those who are active for less than an hour weekly. Moderate exercise includes very brisk walking, heavy cleaning such as washing windows, vacuuming and mopping, mowing the lawn, cycling and badminton. It is said that more than half of physicians, practice nurses, oncologists and cancer nurses did not speak to their patients about the possible benefits of exercise or only spoke to a few of them. Some experts believe that if physical exercise were a drug, it would be hitting the headlines. So folks, get those tracksuits out and hit the gym to lead a healthier and fitter life.
And well, to discuss more on this, I'm joined in today in the News 9 studios by Dr. Niti Narang, who's an oncologist, and Dr. Nanda R, who's an oncosurgeon. Thank you so much, doctor, for joining us. First of all, what is the connection between smoking early in the morning and cancer, Dr. Niti?
There are a few studies which say that early morning smoking and also the depth of smoking, the intensity of smoking does affect many cancers. And in our country, we know head and neck is the most common cause of cancer. Lung cancer is the most common cause of cancer morbidity and mortality globally. And we have other cancers like stomach cancer, pancreas cancer, bladder cancer, which are all known to be related to smoking.
Right, and also exercise which can help cancer patients. How exactly do we define that?
Exercising increases the expansion of the lung and also increases the opening up of the alveoli and increases the oxygen carrying capacity of the body. Also, it also increases your concentration on the brain itself, because when you do a lot of physical activity, your focus is mostly on your physical activity that you're doing. So the normal hypersensitization, irritability that you have in mind, it reduces. So as it is, body immunity is all about mind, because immunity comes from the brain. So the signals for immune function of whole body comes from the brain. So by doing exercise and yoga and stretching, it focuses your mind. So why people smoke? People smoke because they want to de-stress. So when exercise itself can de-stress, why smoke?
So it's all in the mind. Are you saying a person can lead a healthier life if he believes that he can?
Surely. I mean, what we have to understand is exercise helps in oxygenation. At the same time, it revitalizes you, it prevents muscle weakness, and all this have definite a positive effect on cancer treatment, whether be it surgery or radiation or chemotherapy. But what we also have to understand is the importance of exercise to prevent cancer. If we have good, moderate to severe exercise early in life, starting from adolescent, it's known to have a very positive effect, and some cancers like colon cancer and breast cancer, they have a positive preventive action, that is, it prevents the formation of cancer. The second importance is while during treatment, the positive effects of exercise, and third most important aspect is cancer survivorship. Once you have finished the active phase of treatment, to maintain a good healthy nutrition, at the same time have a balanced exercise, whether be it jogging, swimming or aerobics or yogas or pranayama regularly in your life, at least 5 days a week of some healthy active exercises do have preventive action of relapse or prolong the relapse in terms of 5-year survival.
Right, and Dr. Nanda, the medicines that are used to cure cancer, to treat cancer patients, it's very strong. It makes the person very weak, fragile. So how exactly do they indulge in physical activities when they are so weak?
No, actually, when you take cancer treatment, they go through surgical treatment, they go through chemotherapy and probably radiotherapy too. A lot of cancers, they go through all this treatment, and there is a lot of stress in the mind too. So once all the treatment is over, they would have gone through so much of stress mentally, it would have made them mentally weak than physically. So because of chemotherapy, yes, physically also they would be weak, but they may need some kind of supplementation also during that treatment. We do give advice on that to these patients when they come for treatment and regular checkups. So once we supplement all the nutrition, it's all about the brain, the concentration that they have to get on themselves, on their body, and they cannot start doing exercise vigorously. We wouldn't advise them to go exactly to the gym. We would advise them to do a lot of stretching, walking, yoga, meditation, pranayama, sudarshan kriyas. These are all very well established protocols that they follow after the treatment that they go through.
Right, and also Dr. Niti here, the nutrition, how exactly do you supplement all the nutrients lost during the treatment, whether it is day-to-day food, or do you have medicines, or do you have some synthetic food items? How exactly do you substitute?
During treatment, it's highly recommended to have treatment, especially chemotherapy or immunotherapy, is known as a catabolic state. The normal muscle breaks down or the normal energy levels come down. So we give more high energy supplements. It could be rich in carbohydrates which have short action, but at the same time it should be high protein diet, and we should have lots of vitamins like fresh fruits and fresh vegetables, which are supplemented at least 4 to 5 times each day during the entire course of treatment. Also, there are nutritional supplements advised. More we encourage use of minerals like zinc, then some vitamins like folate and biotin, and all this would be given as nutritional supplements as tablets or sometimes protein powders.
And also, can exercise prevent cancer?
Yes, exercise, I would say it does prevent cancer, because as you know, whole of our body, 60 to 70% of the body is made up of muscles. So if you keep your muscular metabolism high, it also reduces the weight. It keeps the consistent basic metabolic rate high throughout the day. It's not that when you go to the gym, you are doing exercise, your body burns calories. Your body burns calories when you're sitting, when you're talking, when you're sleeping too. So at that time, the muscular receptors that work, they help a lot. So they burn a lot of calories in the body. It reduces the body weight. Also, exercising improves, as I said, improves the oxygenation levels in the body, and it also helps you to reduce hypersensitization in the brain that happens to all of us throughout life. Because when we are working, we think a lot of things. We lose a lot of focus on what we are doing because we have too many things to think. So this causes hypersensitization, as I said before. So by doing exercise and yoga, stretching, you learn to focus on what you're doing, because it improves that capacity. And that reduces the stress also in the body. Because what happens when you are irritable, or you have some kind of external stress that is happening in your day-to-day life, it increases stress hormones in the body. Stress hormones are not good for the body because they cause a lot of harm to a lot of cells in the body, and it reduces the body immunity. They also are known to cause, stress hormones are known to cause immune suppression in the body. Because of immune suppression, you are prone for many diseases, including infections. And long term, if it goes on like this, it can also lead to malignancies in the body. I would not take one particular system, it can happen to any system in the body. So this is how exercise and yoga, meditation, it improves your brain function, and it improves capacity to tolerate stress, because all of us have stress in life. So we just need to learn how to accept stress. It's easy to say, difficult to follow it. So, but this physical activity is known to help us in facing this stress better.
Right, and also doctor says someone exercises regularly, he eats good food, but on the other hand, he also is a habitual smoker. So does that cancel out all the exercise and all the good food habits that he has?
Cancer is not dependent on one particular factor. It's a whole spectrum of factors which affect, be it alcohol or smoking, less physical activity. Even if he's a very active person, there could be certain baseline factors like environmental factors. He might be a mining worker or something which exposes him to certain chemicals, or he could be having some baseline familial or genetic factors which predispose him to cancer. So all in all, cancer depends on so many factors. Yes, we can add up good factors like having a good diet and a good lifestyle and trying to avoid alcohol and tobacco if possible, and having regular physical activity. They may cut down incidence in a certain way, but there might be other factors which could still cause cancer.
Right, and also you mentioned about cancer survivors. What kind of routine should they have regarding exercise and food, nutrition?
Immediately after treatment, a person might have a lot of muscle loss and might be very weak to sustain heavy exercises. So we always encourage them to step up exercise in a regular fashion. It's always important to have an involvement of an occupational therapist and a dietitian along with basic person who advises physiotherapy and exercise. Certain type of cancer have a very systemic protocols of exercise, like a breast cancer would have shoulder exercise, a colon cancer would have some exercise, a person who has had gastrectomy would have another set of exercise, and at the same time diet. But what is basically encouraged is to do all your regular activities, and on a weekly basis increase activity as much as you can tolerate and as much as body can sustain.
Right, and also doctor, can you highlight the importance of yoga for a cancer patient or someone who has managed to survive cancer?
Yeah, as I said, after cancer treatment, they cannot immediately start doing the vigorous exercises. They have to go very slowly. As you know, as it is, yoga therapy and yoga treatment itself is very slow, and it is always under guidance of a guru that you do yoga. You learn from them. So when you're doing yoga stretching, it involves the whole body, and it also mostly involves, as you know, it focuses on your breathing, that is lung expansion, chest expansion. There is a lot of focus happening on one particular movement in the body, which increases your concentration too. And because it is very slow, the yoga stretching that it has done, it doesn't harm any individual for that matter, any individual with any disease, it doesn't harm. So if you do it under guidelines, and if the teacher who is teaching, he knows what you cannot do and which part of the body is affected, he can also guide you accordingly to do it slowly in that particular area, and slowly you can increase it. And secondly, what happens because of the treatment, as Dr. Niti was saying, there is a lot of catabolism that has happened. Muscles would have lost their strength, and they would have become contracted, and they would have become smaller. When you stretch them gradually during yoga therapy, the gradual stretching day to day increases the circulation in the muscles, increasing number of receptors in the muscles, and it slowly strengthens them.
Right.
So it actually helps the patient both in physical activity and mental well-being of the patient. So that's
right, doctor. Well, stay healthy, exercise well, eat good food, and especially for you cancer patients out there, a walk a day is very, very important. Simple exercises can keep you healthy, can increase your lifespan and develop your immunity, is what Dr. Niti and Dr. Nanda told us today. Well, thank you doctors for joining us. But that is a wrap on this edition of Good Life Mantra. Thank you for watching.